Morning everyone. I am Dr. Kalpana Sharma, Associate Professor, Department of Zoology, S.P.C Government College, अजमेर। बच्चों, आज मैं बीएससी पार्ट 2 में आप लोगों को हेपेटाइटिस के बारे में बताने जा रही हूँ। What is hepatitis? Hepatitis refers to as an inflammatory condition of the liver. जब लिवर के अंदर इन्फेक्शन हो जाए, इन्फ्लेमेशन हो जाए, तो उसको हम कहते हैं हेपेटाइटिस। It's commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and alcohol. Autoimmune hepatitis is a disease that occurs when your body makes antibodies against your liver tissue. According to CDC, trusted source, approximately 4.4 billion Americans are currently living with chronic hepatitis B and C. Many more people don't even know that they have hepatitis. Treatment options vary depending on which type of hepatitis you have. You can prevent some forms of hepatitis through immunizations and lifestyle precautions. Your liver is located in the right upper area of your abdomen. It performs many critical functions that affects metabolism through your body. What are the various critical functions of liver? Number one, bile production, which is essential for digestion, filtering of toxins from your body, excretion of bilirubin, cholesterol, hormones, and drugs. What is bilirubin? A product of broken down RBCs. Breakdown of carbohydrates, fats, and proteins. Activation of enzymes, which are specialized proteins essential to body functions. Storage of glycogen, a form of sugar, minerals, and vitamin A, D, E, and K. Synthesis of blood proteins such as albumin and synthesis of clotting factors. These are the various functions of our liver. Now, how many types of hepatitis are there? There are basically 5 types of hepatitis, namely hepatitis A, B, C, D, and E. What is the source of hepatitis A? It is the feces. B is the blood or blood derived from body fluid. Hepatitis C source is blood or blood derived from body fluids. And the source of D is blood or blood derived body fluids, and E is again the feces. Now, the route of transmission of hepatitis A is fecal oral. Hepatitis B is precutaneous premucosal. Hepatitis C is precutaneous premucosal. Hepatitis D is precutaneous premucosal, and hepatitis E is the fecal oral. What is a chronic infection? In hepatitis, is there any chronic condition or not? Depending upon types of hepatitis. In hepatitis A, there is no chronic condition. Hepatitis B, there is a chronic condition. Hepatitis C also, there is a chronic condition. In D also, there is a chronic condition. But in E, there is no chronic condition. What is the prevention method of various types of hepatitis? Hepatitis A is pre or post-exposure immunization. Similarly, in hepatitis B also pre and post-exposure immunization. In vitamin C, in hepatitis C, blood donor screening, risk behavior modifications. And hepatitis D, pre/post exposure immunization, risk behavior modification. and hepatitis E ensures safe drinking water. There are 5 types of viral hepatitis. Viral infections of the liver that are classified as hepatitis includes hepatitis A, B, C, D, and E. A different virus is responsible for each type of virally transmitted hepatitis. Hepatitis A is always an acute short-term disease, while hepatitis B, C, and D are most likely to become ongoing and chronic. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. अब एक एक करके एक एक हम हेपेटाइटिस को देखेंगे. हेपेटाइटिस ए, इट इज कॉज्ड बाय इन्फेक्शन with the hepatitis A virus, HAV. This type of hepatitis is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis A. Hepatitis B. Hepatitis B is transmitted through contact with infectious person body fluids such as blood, vaginal secretions, or semen containing the hepatitis B virus, HBV. Infection drug use, having sex with an infected partner, or sharing razors with an infected person increase your risk of getting hepatitis B. Thirdly, it is estimated by the CDC trusted source that 1.2 million people in the United States and 350 million people worldwide live with the chronic disease. Now we come to hepatitis C. Hepatitis C comes from the hepatitis C virus, that is SCV virus. Hepatitis C is transmitted through direct contact with infected person body fluids, typically through infection or injection, drug use, and sexual contact. SCV is among the most common blood-borne viral infection in the United States. Approximately 2.7 to 3.9 million American trusted sources are currently living with the chronic form of this infection. Now about hepatitis D. It is also called as delta hepatitis. Hepatitis D is a serious liver disease caused by the hepatitis D virus or HDV. HDV is contracted through direct contact with infected blood. Hepatitis D is a rare form of hepatitis that only occur in conjunction with hepatitis B infection. The hepatitis D virus can't multiply without the presence of hepatitis B. It is very uncommon in the United States. Hepatitis E. Hepatitis E is a waterborne disease caused by hepatitis E virus or HEV. It is mainly found in an area with poor sanitation and typically results from ingested fecal matter that, that contaminates the water supply. This disease is uncommon in the United States. However, cases of hepatitis E have been reported in Middle East Asia, Central America, and Africa, according to the CDC trusted sources. Causes of non-infectious hepatitis: alcohol and other toxins. Excessive alcohol consumption can cause liver damage and inflammation. This is sometimes referred to as alcoholic hepatitis. The alcohol directly injurious to the cells of your liver. Over time, it can cause permanent damage and lead to liver failure and cirrhosis, a thickening and scarring of the liver. Other toxic causes of hepatitis includes overuse or overdose of medications, and exposure to poisons. Autoimmune system response. What is this autoimmune system response? In some cases, the immune system mistakes the liver as a harmful object and begins to attack it. It causes ongoing inflammation that can range from mild to severe, often hindering liver function. It's 3 times more common in women than in men. Common symptoms of hepatitis. If you have infection, forms of hepatitis that are chronic like hepatitis B and hepatitis C, you may not have symptoms in the beginning. Symptoms may not occur until the damage affects liver function. Signs and symptoms of acute hepatitis appear quickly. They include what are the various signs and symptoms of acute hepatitis? They are fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, yellow skin and eyes, which may be sign of jaundice. Chronic hepatitis develops slowly, so these signs and symptoms may be too subtle to notice. Thank you.